This is Eyewitness News, now at 5.
As officials grapple with getting the vaccines out to more people, there are still too many who say they're reluctant to receive it. What effect could that have on the general public, and what should you do while you're waiting to get vaccinated? Dr. Richard Seidman, Chief Medical Officer for LA Care, joins us now to explain. Dr. Seidman, thank you for joining us. We have a skyrocketing case rate, as you know. What are your concerns about people who are hesitant to take the vaccine, especially in hard-hit communities?
Well, we certainly understand that some people are concerned about the safety of the vaccine, and there's some history with vaccine administration and experiments that were done in the past that give people good reason to be concerned. In the meantime, the demand for vaccine far exceeds the ability to deliver it. We need to continue to make progress immunizing our healthcare workers and the residents and staff at long-term care facilities, so we can move on to vaccinating our seniors and frontline essential workers. In the meantime, for people who are hesitant, I recommend people find trusted sources of information like the CDC, the state and local health departments, and learn what they need to learn to get comfortable and take the vaccine.
There have been some critics of the tier system where you start with healthcare workers, move to people over 75, then to 65 and on down according to various categories. Some folks are saying just get it out there to as many people as you can. The tiers will take care of themselves. Where do you fall on that?
Well, I think we have to respect the expertise of the national committee that has looked at the data and has modeled what strategy works best to save the most lives and get society functioning again at the greatest levels. As balancing those two things is the basis of the recommendations. It's very, very hard to be patient at this time, but I think a lot of thought has gone into the phases and the tiers. We're almost there in Los Angeles County. We're there in other parts of the state and other parts of the country. We have about 500,000 people to immunize our healthcare workers and the residents and staff at long-term care facilities where we saw the highest rates of death. So we need to get those people vaccinated, and then we'll get on to our seniors and frontline essential workers.
And what's your advice to those who are waiting and are looking at it could be months away?
Yeah, thanks very much, Mark. I think the most important thing is we need to follow and understand the importance of the basic public health guidance. Wear your mask, watch your distance, wash your hands, and avoid gathering with people outside of your immediate household. Next, you make sure that when your time comes, get immunized. And third, remember that January 31st ends the open enrollment period for Covered California. It's never been more important to have health insurance. LA Care staff are ready at all times to answer your questions so you can get the information you need to get the coverage you need.
All right, Dr. Richard Seidman, Chief Medical Officer with LA Care, thank you for joining us and answering our questions.